May I please invite the next set of chairpersons? The next session on the basics of laparoscopy from ergonomics to contradictions. And to chair the session, may I invite Dr. Biju Senadipadan from SIMS Trivandrum, Dr. Muhammad Ismail, Maulana Hospital Perindalmana, Dr. Vinod from GMC Alapi. Speakers for this session, Dr. Biju, Dr. Biju Pottakkat from Jipmer, Puducherry, Dr. Alfie from Jubilee Mission Thrissur, Dr. Padma Kumar from Lake Shore Cochin, and Dr. Ashwin Thangavelu from Ashwin Hospital. May I request the chairpersons and the speakers to kindly take your seats on the dais quickly, please. And ladies and gentlemen, as you are aware, at 12:45 we have a session, Teachers of Tomorrow. A short video will be playing for you now.
Good morning to all. May I invite Dr. Biju for his first talk.
Good morning to all. We'll just briefly talk about the ergonomics in laparoscopy. So ergonomics essentially means, this is a very highly technologically advanced field. You are making the settings and surroundings most favorable for the surgeon and staff. So it's a multi-staff business. Okay. So when you establish a minimally invasive surgery program, so these are the components. You need a skill set along with a specific set of patients. Okay. So when we talk about ergonomics, it's all about the infrastructure inside the operation room environment, the equipments, and the instrumentation. So this is a very highly injury-prone area. Okay, so as of today, the injuries during laparoscopy is more than the injuries during open surgery. It's a scientifically proven fact. So the most important determinants of why these injuries happens, right from the defective instruments to situations, for example, where the reporting mechanisms are so robust and you are mandatorily have to report, those systems report higher incidence of injury. This is just like a incidence of criminal cases in any state. So in India, probably we go with a preset mind that even if injury happens, it will not be reported, nothing going to happen. So reporting incidence is quite a bottom. So that is also contributing the factors of injury. So we have to critically understand what basically is a minimally invasive surgery. It's an indirect vision interface. When you operate on a patient directly, you are right away looking at the patient. Your hands, it's right away in the straight line. Whereas in a laparoscopic surgery, a patient is in a different location and you are looking at the monitor and doing this surgery. So it's that interface is coming between the surgeon and the patient. So you are basically trying to adjust to a virtual environment. So there are a lot of what we call decoupling happens. You want to do a joint exercise, but what happens? There are a lot of decoupling happens. One of the important decoupling happens in minimally invasive surgery is you are not seeing the operative field, neither you are seeing the instruments. You are straight away looking at the monitor and seeing only the tip of the instrument moving. Okay, so instrument is somewhere, you are not seeing the handle and you do not actually have a depth perception. The 3D imaging what we normally see is it's a processed 3D. You know that it's not the actual 3D what we get. It's a process, it's an artificially made 3D environment. Okay. And there are a lot of postural issues also in laparoscopy. In open surgery, you move around a lot. In laparoscopy, it may not be possible. So how to circumvent all these problems into a most comfortable environment? So when you talk about operation theater setup, operation table is very important. So operation table in open surgery is usually adjusted according to your hand position or your height. But in laparoscopic surgery, you have an extra 30 centimeter of instrument outside the abdominal wall. So your hand length is essentially more. So accordingly, around 20 to 30 centimeter, you have to down the table and your instrument should be at the elbow level. You can also do what we call the zonal adjustment because the table most of the operation theater tables can be broken into 3 areas. So these sort of upper end elevation, lower end elevation, all this you can do. Talk about monitor position. Normally in most of the surgeries nowadays, you need 2 monitors, okay? Because in open surgery, everybody see the operation field. Whereas in laparoscopy surgery, the best monitor is looking at the surgeon. So you need a surgeon monitor as well as exactly on the opposite side or on the side of the patient, you need a monitor for the assistants also. And when you have a camera, normally nowadays the camera will give you a planar vision, not the circular vision. The target organ concept in laparoscopy is something different which you use in robotic surgery also. You need a center point as a point of action in all laparoscopy and robotic surgery. What it does is, your maximum area of action, that is the center point. Accordingly, you make a perimeter and put your ports and make your actions there. So this is called the target organ concepts. So when you dissect out the zones in the near the patient, these are some of the zones you can see in the surgery. So 1A is the normal position. Let us say you are doing a gallbladder surgery, you stand on 2A. So there is a surgeon zone, there is an assistant zone, there is an instrument zone, there is a staff. So this zonal identification is very important. So there are secondary zones where you can keep the gas cylinder, oxygen and monitors and accessories. So how to manipulate these zones very effectively is the trick of doing a perfect laparoscopy with no strains. I hope this angles, the next speaker will talk. Basically, you should have a clear understanding about the angle between the camera and the instrument, angle between 2 instruments where you are working, and there is an angle between the instrument and the abdominal wall. Okay. So if these 3 angles are maintained in general at 30 to 60 degree, your surgeries will be more comfortable. So the problem happens when the angle between this will reduce it and you will develop the shoulder pain and it will be difficult to maintain the surgery duration. So this is very clearly employed in robotic arms. Robotic arms, these angles are scientifically studied and prefixed. So what happens, it will not, you will not able to move the robotic arm if you compromise certain angles. So surgeon's hands usually the ideal position is abduction, retroversion and rotation towards shoulder level and elbow around 90 degree. Just relax from the 90 degree. That's what we need in surgeon's hand. So this hand-eye coordination is extremely important. Why this hand-eye coordination is important? Because if you don't have the hand-eye coordination, you will take lot of time, and this is one of the major determinant for sustaining injury. So you try to learn it before the surgery in skills lab, dry and wet lab. So laparoscopy instruments are generally soft. So these instruments are becoming more and more soft, more tissue friendly. If you see the robotic instruments, these instruments are basically derived for prosthetic surgeries, and these instruments are really hard. Even if you hold it tight in intestine, it may just cause injuries. These are the possible instrument tip movements. We have a lot of instrument tip movements evolving. So now we have approximately 4 to 6 degrees of freedom, and it is ever evolving. Whereas in the robotic surgery, you are around 36 degrees of freedom. These are the required equipments in the operation room environment. There are a lot of health issues coming for the surgeon. If you are not really careful, all the points which I mentioned, in a chronically, you will develop a lot of sickness feeling. You will high strain spondylitis, back pain, carpal tunnel syndrome, and what we call the fixed laparoscopy. All this can go into a cycle of diseases. There are new generation equipments which really made our life more easy. There are ST monitors. So these equipments are pre-built to circumvent all these ergonomic issues. So nowadays modular integrated MIS operating rooms are coming. There are vendors who can make it, which will make you more comfortable. And to circumvent this ergonomics in a more better way, you have artificial intelligence is coming. So you know that robotic surgery is performed on artificial intelligence. What we are going to see in near future, the arm of the instrument, the handle of the instrument is going to be more artificial intelligence friendly, so that it will receive tissue feedback as well as it will control your movement. So you will be more near the patient, you will be able to control the environment in a much more better way. And thank you very much for the kind attention.
Any quick remarks, sir, from the chairpersons?
Thank you, Biju. Very good presentation. I would suggest this keeping of the monitor, especially if a short nerve. It is as in the computer we are looking continuously. It is better to have in a just higher position so that you won't get the cervical pain. If you look at down, you may get after some time you may get the pain in the shoulders. And always your hands should be in the upper limit as. Any comments from the audience?
May we move on, sir?
Yeah.
Thank you.